the Homefront Family Campus, where we're here for an amazing, very important event today. For the last 27 years of my life, I have worked as an advocate for those who deal with the challenges of drug addiction, mental health, incarceration, poverty, and homelessness. I am currently the director of this amazing village of hope called the Homefront Family Campus, where I am lovingly known as the mayor. So I get to welcome the governor. All right, so here at Homefront, our mission is to end homelessness by harnessing the resources and expertise of the community. We lessen the immediate pain of homelessness and help families become self-sufficient. We work to give our clients skills, opportunities, ensure adequate incomes, and we work to increase the availability of adequate, affordable housing. While our residents are battling homelessness, they are often also battling addiction and substance use disorder. And so we, here at Homefront, must also confront the challenges of addiction by providing recovery programs and services to our residents. Specifically, our program focuses on providing addiction treatment and support to pregnant and postpartum women. We provide case management and housing support, and we connect these women to substance use disorder treatment, legal services, educational support, including GED training and employment readiness services. With the work of my amazing staff and Governor Murphy's funding of our substance use disorder program, we have positively changed the lives of over 50 families and individuals. In March of this year, we welcomed a young woman into our program who was struggling with the battle of addiction. Our staff and program officers worked tirelessly with her so that she could enter sobriety and build her life and start it all over again. After spending several months in our program and receiving counseling and treatment services, I had the honor of walking this woman down the aisle at her wedding. Latoya, are you here? Latoya's wedding was the second. We had another amazing opioid recovering addict who we also had the pleasure of seeing her get married in December of 2018. After spending several months in our program and receiving counseling and treatment services, Latoya, just like those who are also in the program with her, will be receiving affordable housing as part of this funding. So we ask, is it important? Is it important to us? Is it a mission that we want to see continue forever? Absolutely so. Because of our substance use disorder program, this new couple will soon be able to move into their home and begin a new sober way of life. Thanks to Governor Murphy, this program has significantly impacted the lives of our residents, and the results have been nothing short of incredible. I would like to now introduce you to Governor Murphy, who through his efforts and administration is working every angle to combat the opioid crisis here in the state of New Jersey.
Let's hear it again for Madam Mayor Sheila Addison. Good afternoon. Thank you so much, Sheila, for that very powerful introduction and the stories you've told. To you, to Homefront founder and CEO Connie Mercer, who's with us. Connie, great to see you as always. Thank you. To my friend COO, Sarah Stewart, also councilwoman here in Ewing. And to everybody on the team here for hosting us this afternoon and for your continued extraordinary work. This is a place where I've been before, and I'm thrilled to be back. It's one of these institutions that makes a difference in our state every single day. It is also an honor, in addition to being with Madam Mayor Sheila Addison up here, it is also an honor to be with our Health Commissioner, Dr. Sharif El-Nahal, to my left. Human Services Commissioner Carol Johnson to my right. Our treasurer in seat 1A, Liz Moyo. By the way, Liz, a former legislator, and we are in your former district. So good to welcome you back. I also want to acknowledge some other VIPs. County Executive, our dear friend Brian Hughes, is in the house. We got some freeholders. Ann Cannon's with us. Ann, great to have you. Lucy Walters, honored to have you. Pat Calavita is with us. Bless you. Ewing Mayor Bert Steinman. Bert, always an honor. Councilwoman Kathleen Waller is with us. Kathleen, great to have you. And to all the other dignitaries, a heartfelt welcome. Homefront is one of the many nonprofit organizations that our administration partners with across our state every day to improve the health and well-being of our residents. Here at Homefront, this focuses on helping to break the devastating cycle of poverty and homelessness. It is also increasingly on helping those caught up in our state's and nation's devastating opioid epidemic, especially pregnant women and new moms. This is vital work we must ensure continues. In the budget that we proposed in early March, our administration committed to maintaining our $100 million investment in directly combating New Jersey's opioid crisis. Amen. On the one hand, I am pleased, and I underscore the word pleased, deeply pleased, the legislature agreed to keeping this line item whole, a line item that will allow us to continue partnering with places like Homefront and designing and implementing programs that are based on thoughtful and data-driven analysis, that put resources where they are most needed to save lives, and which remains ever mindful of the communities the opioid epidemic was ravaging long before it made mainstream headlines. And I want to underscore what I said, bless you, a minute ago, data-driven analysis. In this, we think of ourselves as Moneyball folks, but in particular, in battling this scourge, we are data-driven. It shows where we agree with the legislature on key values. But once again, it also has highlighted where we have diverged. Our budget asked the big opioid manufacturers and distributors whose products and marketing have contributed to the epidemic to kick in $21.5 million toward that $100 million that New Jersey will be spending on our anti-addiction efforts. I don't think that asking companies with billions of dollars in collective profits to split a modest 20% share of our overall spend is at all out of line for all the pain the opioid epidemic has caused. I believe it is something that a broad section of New Jersey would consider as simple fairness. If we are to be able to maintain this investment long term, we will need the sustainable and fair revenues from asking these companies to be part of the solution. And yet the legislature's budget gives them a pass. It asks, in fact, from them nothing. The legislature has protected the opioid industry's interests and profits and put the entire $100 million burden of our entire opioid program squarely on the shoulders of New Jersey taxpayers. And with so many things elsewhere in the legislature's budget, this omission leads one to ask a very simple question, once again, whose side are you on? And again, I'm on the side of our taxpayers and of the countless families living day to day in the midst of the opioid epidemic. The opioid manufacturers and distributors must be asked to pay their fair share. Just as with our other initiatives built on simple fairness, we will not drop this argument on June 30th. We will continue to fight for the common sense policies that will loosen the grip of special interests to move our state forward. Fighting our opioid epidemic will take all of us working together. The administration, the legislature, nonprofit partners like this extraordinary partner, our healthcare network, and yes, the opioid manufacturers and distributors who also bear a responsibility. With that, I would like to invite the Commissioner of the New Jersey Department of Health, Dr. Sharif Elnahal, to join us to say a few words. Sharif?
Good afternoon. I want to first thank the Governor for allowing me to address all of you today. You, Sheila, for everything you do for this community. LaToya, your experiences are truly inspiring, and all of the other patients and residents who come through here. We work for you, and in the state, we're here to advance your health. And thanks to my colleagues in the cabinet here today, Human Services Commissioner Carol Johnson, and our great treasurer, Liz Moyo, and thanks to my team, including Natasha Rosario, our director of opioid response. Ladies and gentlemen, the governor's proposed opioid fees are important. This isn't just about meeting a revenue target for our state budget. This is life and death. The revenue raised for this measure represents an opportunity to save a loved one, a friend, even yourself. I was fortunate to visit a pharmacist named John Power on Naloxone Day, a great day organized by my colleague to the right, Carol Johnson, and her department, in Burlington County last week. He was the first pharmacist to sign up for our standing order program, which is a generic order that I write for a life-saving antidote called naloxone, which anybody can receive without a prescription. For John, this was personal. His own son died of an overdose at the age of 23. Naloxone wasn't there when he needed it. And now he doesn't just dispense naloxone, he educates his entire community about it. That day, I met people from all walks of life, a microcosm of this entire state. A man picking it up for a friend addicted to painkillers, a woman whose daughter struggled with heroin, a group of librarians who were worried about overdoses within their own building. This epidemic has spared no community, and one thread that is common in many of these stories is that the majority start with a prescription drug. Prescription drugs, while they are only part of the story of this epidemic, fuel much of the addiction problem in this country. A national survey on drug use and health study found that 4 out of 5 people previously used heroin within the previous 4 months had used prescription opioids for non-medical reasons before that. It is simply good policy to curb this supply and hold companies that distribute and manufacture opioids accountable. And so to get there, the governor's proposal does 3 things. First, it increases transparency around which companies are manufacturing and distributing. At present, we don't actually know which companies are doing so and how much they manufacture and distribute because they do so for a wide variety of drug types. Number 2, it allows the health department to impose fee increases on all manufacturers and distributors of drugs on a sliding scale, with the highest fee increases imposed on those companies that manufacture large volumes of opioids. And by the way, these fees have not increased since 1983. It's currently just $200 to $500 per year, depending on the size of the operation. And the third thing it does is it increases penalties on those companies that are not compliant, and assesses uniquely high penalties on opioid manufacturers and wholesalers who are not compliant. We scored the expected revenue of this to be $21.5 million. This is an extremely conservative estimate, knowing that we will likely have much more accurate information on which companies and how many manufacture and distribute opioids by the end of next fiscal year. But whatever the final number, think about what we can do with those resources to break the back of this epidemic. With a better state financial position overall, our department can free up more resources for things like providing clean syringes and expanding our syringe access programs, offering a better data infrastructure to our substance use disorder clinics, and extending innovative programs like one that we just announced yesterday, that we will be the first state in the nation to allow paramedics to administer a medication called buprenorphine to treat withdrawal right after a Narcan reversal, lowering the chance that folks will use shortly again after they see a paramedic. Providers have told us that it's an all too common story where they show up to the scene of an overdose, they administer Narcan, and then someone literally runs out of the ambulance only to find the same call for the same individual later that night. We listened to our first responders and we took action. Please help us do work like this to an even bigger scale by supporting the governor's proposal. Thank you.
Thank you. Thank you. That's pretty powerful, compelling words, Sharif. Thank you. Sharif mentioned that last week we had our first ever free giveaway of Narcan up and down the state, I think through 174 locations. And Sharif was very involved, but Carol and her team ran this, and it was a huge success. And if you look at the lives, statistically, that in that context, Please help me welcome our Commissioner of the Department of Human Services, Carol Johnson.
Good afternoon, everyone. Thank you, Governor, and thank you to my colleagues in the Cabinet, and especially to Connie and Sheila for the work that you do. I have seen firsthand how incredible that is. I want to take a point of personal privilege to just say before we started today, Connie showed me some of the babies who are in the child care center now because of a policy change the governor and I made with respect to getting children who are homeless access to child care. So thank you for that work. As Sharif pointed out, and as the governor has consistently said, a strong and sustainable budget is an essential part of turning the tide of the opioid epidemic. To give you a sense of some of what we've begun under the governor's first year of his $100 million opioid investment, last week, as the governor noted, we distributed more than 32,000 doses of the opioid overdose reversal drug naloxone, commonly called Narcan. 16,000 New Jerseyans showed up for our free giveaway day. We asked New Jerseyans to stand with us to be part of the solution to this epidemic, to get naloxone, and to be prepared to save lives, and they showed up in overwhelming numbers, and we're incredibly grateful for that. It's because we know that things work when it comes to combating this epidemic. Naloxone is one of them, but another is medication-assisted treatment for opioid addiction. Here, we simply don't have enough of that in our state. So we're making critical investments under the governor's initiative to expand access to medication-assisted treatment, or MAT. First, we're training more healthcare providers to offer MAT. Doctors, advanced practice nurses, and physician assistants are required by federal law to go through a training and get a waiver to offer MAT. We're paying for this training through the governor's initiative with the goal of increasing the ranks of New Jersey healthcare providers who can offer MAT. When we started, we had about 1,500 of these so-called data waiver providers in New Jersey. We've completed 7 of the 18 trainings we're supporting that we'll do this calendar year, and we've already trained more than 300 additional providers to offer medication-assisted treatment in our state. And we're working now on getting them all waived. We've also used this training to highlight the opportunities that we've made to change payment policy in New Jersey Medicaid to encourage more healthcare providers to offer opioid treatment. We've removed Medicaid prior authorization requirements for MAT so that people can access this treatment when they're ready to receive treatment, and we don't lose them to treatment while they wait for prior authorization. We also think that this will help us encourage more healthcare providers to offer opioid treatment because there'll be less paperwork and less time involved in offering the treatment. We've changed how we pay healthcare providers in Medicaid so that more healthcare providers will offer opioid treatment. Primary care providers will now be able to bill for navigator services so that the doc can do the medication-assisted treatment and the navigator can help connect people to counseling and social services support, which we know is so critical to getting people on the path to recovery. And starting in July, we'll begin paying for peer services in Medicaid so that individuals with lived experience can help us get and keep people on the path to recovery. In addition, we're supporting critical partnerships like the one here in Homefront to support pregnant women who have opioid addiction. This partnership is Homefront, the Rescue Mission of Trenton, Catholic Charities, Capitol Health, working together to bring the resources of this community to help support women on their path to recovery. I've met some of the women in the program. It is an incredible story of outreach, sustaining that outreach, providing the services that ensure that people come and get the services and stay connected to care, and then thinking very critically about what it's going to take to help people who are in recovery get back on a path to economic security. So there's many initiatives and other programs in the governor's $100 million budget that I could highlight, but I don't want to leave without mentioning one that we're really excited about that is innovative here in New Jersey, and that is our focus on social determinants of health, the social factors that play such a critical role in helping ensure that our healthcare investments are sustainable. So we're particularly excited about work our Division of Mental Health and Addiction Services has done with the Department of Labor on the Pathways to Recovery initiative, where with support from the governor's investment, labor is supporting job training and economic opportunities for people impacted by the opioid epidemic. So this is just a snapshot of what the governor's investment has done, But this is really, it requires sustainable funding for us to be able to continue these initiatives going forward. I have to tell you, the last time I was here and I was around the table with many of the women in the program here, the most frequent question we got was, will my friends be able to participate in this? Will it still be here when they need it? And our message is, we need sustainable funding in order for that to be the case. So the opioid assessment is about both accountability and sustainability, because there's so much more work to do, and to do that work, every dollar counts. So the more resources we have to support individuals, families, and communities, the better chance we have of turning the tide of this epidemic. Thank you.
Thank you, Carol. Well done. Thank you, Carol. Thank you, Sharif. Thank you, Sheila. Now, as I say in football, I'm calling an audible. So bear with me. This is in the same, inside the same church, but we're going to a different pew, as my parents would say growing up. Since its beginning, our administration has focused on public health as a key indicator of our state's progress. You just heard both Sharif and Carol speak to that. Healthy communities are communities where we can more directly attack poverty and its root causes, where kids can have a better chance at an education and a bright future, and where we can focus new investments in affordable housing and job creation. For the past 16 months, we have had a strong and transformative leader at the Department of Health, the guy to my left, in Dr. Sharif El-Nahal. His acceptance of the leadership at University Hospital in Newark led us to undertake a search for someone who can pick right up where he is leaving off, and for a new commissioner who shares our vision of high quality and affordable health care, not just as a right of every New Jerseyan, but also as the base for building a stronger and fairer state. As it turns out, we did not have to look very far. I am pleased to announce my intent to nominate Judy Persicelli to be our next Commissioner of Health. But this is the ultimate all of the family story. For the past 11 months, Judy has been our point person at University Hospital, working to turn that institution around financially. I feel this way sometimes, and I completely understand that. To turn that institution around financially and administratively, and to restore its reputation as a place that residents can trust for comprehensive health care. By any measure, her work has been a success, and University Hospital is now on the road to recovery. As a nurse, as an administrator, and as someone who has been intimately involved in healthcare policy at nearly every level, Judy brings a long and distinguished career of insight and practical experience to one of our state's most critical jobs. Judy and her family, like the Murphys, believe that it takes a village in life. And with Judy today, in fact, is a big chunk of her village. Sitting to her right is her husband, Tony Persicelli, former mayor of Pennington. Tony, great to have you with us. Her brother, Jim Mella, and his wife, Tara, to my left. Dino and Cindy Persicelli, niece and nephew, respectively, and their kids, Carly and Dan. Let's hear it for the greater Persicellis. Judy and Bob Rotkamp, nursing school friend of Judy's and her husband. Juliana and Wendell Probilla. Juliana's a nursing school friend, and Wendell, as we know, is the former mayor of Ewing. Great to have you, Mr. Mayor, with us. Dr. James Romano, a friend and physician. Bill Watson in the back, a friend, and also happens to be Bonnie Watson's brother. David Knowlton, friend and former Deputy Commissioner of Health for the state of New Jersey during the administration of Governor Tom Kane. And Joseph Trotto, a friend. Let's hear it for that whole team. I'm going to do that list alphabetically or by height next time. Judy will be the first Commissioner of Health to have started her career as a nurse. And I know that she will also be a strong advocate for opening the eyes of more of our residents to seek a career in nursing. Amen. As we continue our work to protect and expand access to fight President Trump's assault on affordable health care coverage for our residents, as we continue to take on our state's maternal and infant health care crisis, as we keep fighting the opioid epidemic, as we've discussed today, and as we continue to keep New Jersey among the very best states in overall quality of care, I and we will turn to Judy to lead the way. I'm excited to have her join our administration, and I thank her for continuing her tremendous public service and to helping us build the strong partnerships that will lead to a healthier state. It is now my honor to introduce the next Commissioner of the New Jersey Department of Health, Judy Persicelli.
Thank you, Governor. Good afternoon, everyone.
Good afternoon.
Now I don't have to introduce my family, so thank you. Just about a year ago, I was staring at a set of golf clubs that my twin sister gave me for my retirement, and I sort of looked at them and said, what am I supposed to do with these? Shortly after that, I got a phone call from the governor's office, and they said, we have some trouble up at university. Could you go up and do a review? I said, well, let me think about it. They said, well, don't think too long. We need to know by tomorrow. So I guess we'd say the rest is history. I do want to acknowledge my husband, Tony. Some of you know him as the mayor, former mayor of Pennington. I know him as the person who cooks dinner, fixes the cable when it doesn't work, and pays all the bills. So I want to thank you, Tony, because I have now failed retirement twice. And you'll be eating alone a couple of more nights. Governor, I can't thank you enough for allowing me to participate in your agenda for the health of New Jersey. It's an agenda that sees health as the foundation of a stronger state. I have seen firsthand the impact that social determinants have on health. When your zip code determines your destiny more than your genetic code. Governor, you and Dr. Elna Hall have laid the foundation for New Jersey to reclaim its premier position as one of the most innovative and responsive states. In a short 18 months, collaborating with hospitals, the Hospital Association, community agencies and institutions, you've targeted the opioid epidemic by reducing opioid prescriptions through our emergency rooms. You've expanded the syringe access program, and you have extended access to naloxone, saving lives every day. And medical marijuana has become a staple for those in need. Funding for women's health services has been restored, and most importantly, the First Lady's agenda, Nurture New Jersey, is targeting improvements in maternal and infant health by setting benchmarks and supporting community-based programs, including the support of doulas. Setting the foundation for systemic change starts with a focus on a robust information network and access to coverage through the state insurance exchange, all laying the groundwork for innovative improvements in the delivery and financing of care. During my work at University Hospital, I had the benefit of meeting and working with a remarkable physician who every day showed me his capacity to actively listen and turn thoughts and concerns into positive actions. I'm proud to call Dr. Elna Hall a friend and a professional colleague. Dr. Elna Hall, your guidance has been a gift to me, and I wish you continued success as the CEO of University Hospital. He's going to work really hard, I can tell you that. I'll be there to help. You know, I read an article many years ago about a physician who worked well into the latter years of his life. And people used to ask him, why? Why are you doing this? And his answer was, I want to do the best I can for the most that I can for as long as I can. Governor, sincere gratitude for giving me this opportunity, and along with you and your cabinet, I look forward to doing the best that I can, for the most that I can, for as long as I can. Thank you.
Thank you, Judy. God bless you. Wow. That is a tough act to follow. Congratulations again, one more time to Judy and your whole network of family and friends. And your twin sister was is that a graduation day?
She's at her college reunion.
Or college reunion, pardon me. I don't golf. I don't have any good ideas for the golf clubs, but I'm sure we can commiserate with you at some point. We'll take a couple of quick questions if we can. Michael.
Governor, what's more important, getting a budget signed by midnight on June 30th, or restoring some of the items that you would like to see, like this opioid?
Yeah, I think, Michael, I'd repeat, and forgive me for Brett Johnson, otherwise known as Bill Murray here, is going to accuse me of doing a Groundhog Day again, but I apologize. I'm going to probably say the same thing. I want to repeat something that I think we alluded to earlier in these remarks. The legislature sent us a budget back that includes the overwhelming amount of the funding of the programs that we care about. And so I cannot say that more strongly. And that means a lot. And so the historic reinvestment in our middle class and the dreams of those who aspire someday to get into the middle class that we began 18 months ago continues with the investments in this budget. There are some tweaks and cuts that I bemoan. The one that I've referred to regularly is the Community College Opportunity Grant Program, where there is funding. The good news is there's funding. There just isn't enough. And so I bemoan some of those tweaks. The bigger concern I have, Michael, as I've said before, is on the revenue side. My ability to certify the revenues, the lack of tax fairness, in particular through a millionaire's tax that's brought from the partial success we had last year down to the $1 million level, the opioid distribution and manufacturing fee we spoke about today, the corporate responsibility fee for the companies who choose not to give health care for their employees, and we're asking those companies to help us defray the cost of those employees turning to Medicaid. That's the bigger challenge that I've got with this budget. I don't want to make light of the cuts that we would like to see put back in, but the bigger issues on the revenue side, and again, at the risk of repeating what I've said already, all options remain on the table. Please. Yeah, as I say, all options are on the table, and we're trying to square all this up in the next few days, and we'll obviously, when we've got something to report, we'll be back to you. Matt.
Governor, with all options ending on the table, what's your message then to thousands of non-essential state workers who might not be showing up for work to get a paycheck?
Yeah, listen, the message I would have is that we were sent here to fix this state and to fix it responsibly. And I take that responsibility deadly seriously. So I want folks to know that we don't make any decisions we make lightly. Please.
Can we interpret all options on the table that it's possible that you will sign a budget without a million tax?
Yeah, I have literally zero new to add to that question, but I appreciate your asking it. Paul, I'm glad to see I'm relevant enough that you showed up, so thank you for being here.
I have two questions on a specific issue. Number one, this revenue would go into the general fund and would not increase the $100 million appropriation.
It would go to defray the $100 million that we have allocated, correct?
$100 million, whether or not this is put back in.
Yes, but I think this is the right thing to do.
The nurse, the assemblywoman who was most opposed to this, points out that in New York, when Governor Cuomo tried it, the court said it could be passed on to the patients, and that would happen with this tax.
Yeah, I don't think we see it that way. Is that fair to say, Sharif? Do you want to comment, or Carol?
Yes, so the New York proposal had provisions that were struck down in court that this proposal does not have. That was struck down because of an interstate commerce-based ruling, and we do not have provisions that would be subject to the same decision. We think this would be.
That's exactly the case. What a different provision.
I mean, I have to speak to the Assemblywoman, but I don't think it's the same situation with the proposal we have.
We deliberately, Paul, went out of our way to design this so that we learned from the challenges in New York. Michael, I think, is it possible I cut you off? Because I don't ever want to be accused of cutting you off.
I think Matt.
He addressed it.
But let me try it again, in case you say something slightly different. A lot of people are on tenterhooks, not knowing whether
Yeah.
they're going to.
I think the folks in this state need to understand, they need to remember why we got elected to be here in the first place, which is to reinvest and rebuild the middle class of this state. And both last year's budget, this year's budget, in fairness, and all the days in between have been a journey toward that, and we will continue on that. That this is all about a stronger and fairer New Jersey that works first and foremost for the middle class and for the dreams, as I was and so many of us in this room were, growing up, looking up someday, dreaming to get into the middle class. That journey will continue, and we will not relent. And that includes finding tax fairness and tax equity, leveling the playing field, and breaking this crazy cycle of stumbling into every June 30th, waking up on July 1st with this wash, rinse, dry, repeat. Part of the reason why you want to have sustainable, predictable revenues that you can actually tie down is that you don't have this just stumbling from one year to the next, that there's a long-term plan in place, and we are committed to standing by that. But I also want to make sure folks know that we're adults, that I take my constitutional responsibility and my role as the chief executive officer of the state deadly seriously, and we don't just make decisions for the sake of politics. We make them based on the interests of the 9 million who call this great state their home. But again, I think it's a question of whose side are you on? That's the question. I know what side I'm on. I want to implore again folks to ask that question. Whose side are you on? Michael. Oh, Michael, now you're at the edge now. I'm sorry?
I said there was some slight variation.
Okay. But just only slight. Thank you, Michael.
On the opioid assessment, even if designed differently than New York so that it sustains any legal questions, how do you ensure that it doesn't just get passed along to patients? It's ultimately not to be borne by the opioid companies. It gets passed along to patients who might be legitimate opioid patients.
We are confident that it won't, but I'd ask either of you to come in and, again, add some more veracity to my answer.
Thanks, Governor. The concurrent thing that we're doing is reducing demand for opioids by working with hospitals and other providers to reduce the need for opioids. And part of that is the regime we have for medical marijuana. So if you're reducing the number of people dependent on opioids prescriptions for their pain or for a different reason, then you're, number one, subjecting that risk to less people, and number two, you're reducing demand. So we hope those two things will not allow for that cost to be borne by too many patients.
You sure? You want to add something, Cheryl?
I'll just briefly say that in addition to medical marijuana, we are using money from the governor's opioid initiative to decrease prescribing where appropriate. So we are investing in the hospital ED program that Judy mentioned. We are investing in local community organizations that are doing outreach and education about alternatives to opioid prescribing. So we are across the board looking at ways to reduce that demand.
Elise, you had something?
On the budget, Governor, have you had any dialogue with legislative leaders this week? Do you anticipate any future budgets?
To be determined, but let me just say clearly they did their met their constitutional responsibility by giving me a budget. I'm the governor. I now have the responsibility with the budget on my desk to determine how this goes forward.
Governor,
Please.
with the budget on your desk then, if you are concerned about your ability to certify revenues, you're concerned about these cuts, why not just veto the budget, take it some time, and then we'll
No, don't get mad at me. Nothing new to add. We're looking at all options. Please.
Given what we've learned about one of these big opioid manufacturers, pharmaceuticals.
I could have predicted this was your question. Waking up this morning, reading what I read. We hold Teva to the same standard as we hold any of these other manufacturers and distributors.
$1 million tax rate.
We-
And have you solicited money from Teva for new direction?
We have, the answer is to the best of my knowledge, no, on the latter. And on the former, we hold Teva to the same standard as every other opioid manufacturer and distributor, and we take that very, very seriously. Brett, did you have something or not?
Yeah. Yesterday,
So I came back to you, right? So you, like Groundhog Day, you wake up the same day, so I came back to you.
absolutely. I'm not a school.
No, that's all right.
But yesterday you had said that there's been a dialogue back and forth with staff, I think.
Yep.
Some lawmakers have are saying there hasn't been. You want to clarify?
That's not true. But again, I repeat what I said to Elise's question. They had their job to do. They did it. Now I have my job to do as the governor. With that, we're going to bring this to a close. I want to thank Homefront for hosting us so graciously. Connie, to you for founding it, and to your extraordinary team, both up here and in our midst. To the elected officials who are here, thank you all for coming out. It means a lot that you would be here. Mayor is our host mayor, county executive, the freeholders, members of council. to the members of my cabinet who are here, both up here and Liz in seat 1A, and to our future Commissioner of Health, Judy Persicelli, and her family and friends. It's an incredible honor to be here with you all today. Thank you all so very much. We got a picture? Bert, thank you, man. Somebody told me you had something happening.